Okay, good morning, everyone. Thank you for being here for our COVID-19 daily briefing for today, Friday, April 3rd, 2020. I'm going to ask you to please bear with us today. We are having to use a different system than we've been using in the past, and its audio is not as good. So we are going to do our best to speak slowly and hopefully not have a whole lot of glitches going on today. So for today's numbers, we have a total of 11 positive cases. We've got 402 negative cases. We have 6 people in isolation. We have another 26 in quarantine, though that number is going to be growing given our new cases last night. We have 2 who recovered, and I'm sorry to share that we have an additional person who has passed away from COVID-19. The 80-year-old, the gentleman in his 80s has passed away. We're very sorry to share. I'd like to introduce our healthcare partners and have them share their updates, anything new that's happened in the past 24 hours. Let's start with Shasta Community Health Center.
Can you hear me okay? Yeah, really nothing new to report. We've ramped up our screening process. We're about to move out some of our clinical services out of an adjacent building, and we're going to really consolidate all our respiratory screening and assessment and care into one smaller facility and keep them out of our main facility as much as possible. It's another way of also being able to maximize our PPE by having it contained this way. So that's our newest twist, and that'll happen on Monday at our main site.
All right, thank you. Mercy Medical Center.
Good morning, this is Robert Folden. I'm the Chief Operating Officer. So we continue to have our monitoring and limited visitor access. Starting Monday, we're going to do some enhanced employee screening and further close currently accessible areas, but we're gonna close the hospital down to just 2 physical entrances. And then we continue to work through our planning process. As you mentioned, we have several persons under investigation or PUIs here at the hospital, and I think our team's doing well. I think our nurses and physicians are ready. We're actively working on the front line, if you will. So I'm proud of our team and this group.
Thank you very much. Shasta Regional Medical Center.
Hi there, my name is Mark Michelson. I'm the Chief Nursing Officer here at Shasta Regional. And between Wednesday and today, it's much of the same, continuing with our screening of anybody coming into our facility, keeping very tight access to anybody who does come to Shasta Regional. One thing that we wanted to really kind of share is just a great thank you to the community with all the gifts, donations. Everybody's looking out for the hospital employees, and it really shows that this community really values its healthcare workers. And just want to say a big thank you to everybody.
All right, thank you, Mark. And I apologize, I can't, oh, Valerie from Mayor's Memorial.
Good morning, my name is Valerie Lakey. I am the Emergency Preparedness Director at Mayor's Memorial Hospital, and I apologize if my sound isn't working extremely well. I'm up here in Fall River Mills. We have not had a lot of changes over the last day or two, but I would like to echo what Mark said and really express sincere thanks to our community and also to our staff who is working extra hard and putting in some long hours to be prepared. As far as here at the facility, we continue to do the same things we have been doing with screening and visitors. We are looking at some more stringent policies related to our skilled nursing facility, because as I've said before, that is one of our top priorities, is to keep those residents in our skilled nursing facility safe.
Thank you very much. And With this new setup, I apologize. I can't see what organizations folks are from. So do we have any other healthcare partners on right now who would like to share an update? Okay, hearing none. We also have Dr. Karen Ramstrom, who is the Shasta County Health Officer, and she'll be available for questions, and she's also going to provide us with some helpful information in just a few minutes. We wanted to reiterate the importance of following the governor's stay-at-home order. Travel between counties should not be happening unless there is an essential reason to do so. We've been getting lots of questions about that. Can somebody come? My sister wants to come from another county. Please do not do that unless it's absolutely essential. We really, really are trying to reinforce that message. Encouraging people to add one more tool to their toolbox of prevention. In addition to following the stay-at-home order and practicing social distancing, the CDC is recommending that people wear masks. All of those precautionary measures. Please don't use N95 or surgical masks, as those are in limited supply and our healthcare workers need them. You can find some helpful information at shastaready.gov. If you click on resources, you'll find a wonderful series of tutorials by the Redding Fashion Alliance. They've been fantastic in really helping to increase our supply of cloth masks in our community. We thank them. So the next thing we wanted to do was I wanted to ask Dr. Ramstrom to help explain the process of contact tracing and what happens when we find out here in public health that there has been a positive test. Karen, would you please do that for us?
Sure, I'm happy to. I'm wondering if that's being hit to mute. I think that's where the feedback's coming. There we go. Great. Is that better sound? Okay, great. So yeah, I'm happy to. So at public health, so COVID-19 is a reportable condition. So whether it's by both laboratories and the ordering physician, the ordering provider, reportable to public health. So when we get a report of COVID-19, whether it's through a public health lab or a commercial lab, we immediately contact the individual and begin our investigation. So individuals who are confirmed are immediately isolated, whether it's at home or they're in a health facility. And we do a formal order, legal order around that. And we interview the individual to see who they've had close contact with back to 2 days before they got symptoms, 2 or 3 days before they got symptoms. And then we contact those individuals and assess whether they have symptoms. And if they did, then we would get them tested. And if they're healthy, we implement a quarantine order for 14 days. So that's kind of our process, and pretty rigorous and involved. Those individuals who are in isolation or quarantine, then we follow them throughout that period of time, have periodic contacts with them, and individuals who are quarantined and healthy at the time, we have them monitor their temperature and for symptom development. And should they develop symptoms, then we help them to find a way to get tested.
All right, thank you very much for that helpful explanation. I think we're ready to open up to questions from the media. Who has a question for us?
Yeah, Darren Leeds from KRCR. You guys had mentioned the one death. I was curious if you guys happen to have any numbers on people who have recovered from the virus?
We do. We have had 2 people of our 11 cases who have officially recovered from the virus.
Thank you.
Can you guys hear me?
Yes,
Sorry.
we can. No, go ahead.
Oh, sorry. Oh, okay. So I was just going to ask, can you, when you were talking about the, the contact tracing and all that process, can you define what is considered close contact that you would, get in touch with one person they've dealt with, but maybe not another? Is that just 6 feet or?
So our nurses and staff are really highly trained in that area. And so they actually interview the person to get a feel for how much interaction they've had with different individuals. So obviously the closest contacts are going to be people in your household that you interact with every day, that you're close to, you're having meals with, that you might be using the same bathroom and potentially the same bedroom. So those are considered very, very close contacts. And then there would be another layer of, you know, maybe it's acquaintances or colleagues that you're talking with. So hopefully for many of those interactions right now, people are, that would help with that buffer, but our very trained health professionals make that judgment in that conversation about how much contact it is.
Okay.
So CDC defines it as more than a few minutes. And so there's a little bit of a judgment call there, and the type of interaction, how close it is, whether a person's masked or not. And so there's a lot of variables that go into that.
Okay. Okay. And then I know at one point, it seems like a long time ago now, but I talked to somebody about the possibility of once community spread is kind of known here. I mean, that's why other jurisdictions have changed the way they do quarantines and basically are not doing those anymore. Is that something, have we gotten to that point here at all?
So we're continuing to do quarantines. We haven't reached that level yet. We're going to reevaluate every day and see how things are going. We're going to do it for as long as we can. We think it's a really important measure in terms of slowing the spread in our community.
Yeah.
We have actually activated many staff in public health and across our agency that we can draw on. And we are going to do it for as long as we can. I think it's going to be particularly important later in this outbreak, after we have our surge, hopefully as more testing capacity comes along, that the contact tracing, isolation, and quarantine is going to be really important to help us to prevent a resurgence as all of us, you know, as some of these restrictions on movement are lifted over time. That's going to be months down the road, but we're taking it day by day right now, and still very much focused on containment, which involves identifying close contacts, limiting their movement, implementing quarantine orders, isolating people who have been.
Okay. And then are you guys, I don't know if you could address it all. I'm hearing a couple of, you know, tips basically that certain businesses are actually not allowing their employees to wear masks, and I'm not sure why. You know, is that, I know it's not like, I don't think that would be like illegal, obviously, but is that something you guys have heard and have concerns about or anything like that? Especially with these new mask orders.
Right. I haven't heard that, but it doesn't mean that hasn't happened. You know, I think this thing is just moving along and changing every day. This new recommendation by the State Health Department, I think we fully support that. Anything that we can do to further protect our residents, and particularly make sure we're ensuring that the PPE and N95 and surgical masks for our healthcare workers and out in the community, I think it makes a lot of sense for adding this additional barrier between an individual who might be pre-symptomatic or have very mild symptoms, just sharing that with others when they're out and about meeting their basic needs at the grocery store, what have you, or if you're doing your essential, you know, work functions. So I see this practice evolve. I think the most important thing to keep in mind is that two things. One, we do not want that to take away from the supply of PPE for our healthcare workers. And two, we want to make sure that if individuals are implementing that practice, that they continue to have physical distancing and wash their hands frequently, do environmental cleaning, and their contact with others to only those essential needs when they're having their out meeting their basic needs.
Okay. And the only other thing I was going to ask is, sorry,
can I interrupt you for a quick second?
Sure.
When you're done asking your question, I hate to ask you this, but when you're done asking your question, could you mute your mic, because we're hearing your typing and it's making Karen cut out.
Okay. Oh, is that what that is? Okay. See, I'm hearing my typing too. I thought I was just hearing it. Okay. The only other thing I was going to ask is, do you guys know with this new civic hospital setup, is that like the financial piece of that? I mean, is there like an amount that you guys can share that Advanced Redding is charging, or is it somehow not being, is there not a cost associated somehow because of like FEMA or something? I guess it's. Now I'll mute myself.
Carrie, do you have any message to share about the FMS? I don't.
I don't have an answer to that specific question about the funding. It's that the heavy lifting on that has been done by the federal government, not by us. We've certainly been cooperating, but I do not know the answer to that question. I can find out and get back to you if you want to send it to me in an email, just to make sure that I have it totally
Okay,
clear.
I'll do that. I will do that. And now I'm done and muting myself. So thank you.
Thanks for your patience on that. I know this system is a little bit clunky.
Yeah, it was difficult. I was like, I could chop in and out with Karen, and then it, turns out it's my fault. So hey, okay, I will do that.
I've got a question. You mentioned that there were. Can you hear me?
Yes.
Hello. Okay. You mentioned that there were 402 tests that returned with negative results. How many of those were done in the public health lab, and how many were in private labs? And is there a backlog of tests that have not yet been processed?
It looks like today we have 149 from our lab and 253 from private labs. We do not at this time have a backlog. We're completing tests in our public health lab. If we receive them by 11, generally the same day, otherwise within 24 hours. Our lab is doing tremendous work in getting these cranked out in very timely fashion. We're pretty proud of that right now.
The state had said that there's a huge backlog, that they have a huge backlog of unprocessed tests. Why is that, and why are you able to do yours so quickly?
Because we're amazing. I don't know. We have made it a huge priority for our lab to get it done. I assume that the other labs just have more. I don't know. You'd need to ask those labs why they have a backlog.
Jesse Angelo, KNN, can you all hear me?
Yes, we can.
I've noticed that the testing criteria on the shastaready.org website has been taken down. I'm assuming there's been some changes to that. If so, what are the testing criteria?
Dr. Ramstrom, do you want to do that one, or would you like me to?
Go ahead, Carrie. I'm not sure what was taken down, so
I'm not certain either, but our testing criteria has not changed.
I just noticed that on the website where it has said testing criteria, that was removed from the page. And then when there's a link elsewhere that says see testing criteria, and it goes to a broken page. I've had a couple of people ask me about that.
Okay, so we put that page together. I don't know why that happened, but so the testing criteria is we are testing what the CDC refers to as tier 1 criteria here in the public health lab. And that is people who are symptomatic and who have also been hospitalized, healthcare workers who've had exposure, people who have direct exposure to a COVID-19 patient and have symptoms, and then first responders who've had contact with a COVID-19 patient. Everyone else, healthcare providers are referring those to the private commercial labs that are our partners in this effort.
Yeah, and this is Karen. I would just add one more group. That's perfect, Carrie. One more group that we're really prioritizing too is anyone who's in a congregate setting, because we want to identify that infection quickly so that we could contain any further spread in a facility.
And I've just been told that the standalone testing page was moved to one of the FAQs on our website. So it just moved around. I apologize for the confusion on that.
Oh, no, thank you very much.
Speaking of the website, I misstated the address. I've typed it about 4,000 times. It's shastaready.org. I gave the wrong little 3-letter code on the end. So go to shastaready.org. You'll find all those things there. Other questions?
I've got a question for Dr. Ramstrom.
Okay.
What is there a certain number of cases? What's the criteria for changing your approach to this? And a certain number of cases, what would make you do that?
That's a good question. So, I think that we are still in a place where we can draw on additional staff. We don't have a lot of nursing capacity in our agency, but we're actually drawing on individuals who don't normally work in communicable disease and training them up to do that work. At the same time, it really does have experienced people involved and available for that. And so I think we're going to do it until we don't have the staffing available to do that. And I think before stopping, and I don't know, I'm hoping we don't get to the point where we have to stop, we would actually prioritize, the level of contact tracing that we're doing, and potentially prioritize those high-risk groups that we need to make sure that we get to identify and inform.
And could you comment on how welcome the field hospital would be?
I think I would maybe, I think it's wonderful that we have this federal asset, that we actually have this resource should we need it. But I would also defer to our hospitals to speak to that, and how that makes them feel to have this backup capacity in our community.
That was my next spot, was Robert and Mark.
So we've sat with Donnell as this planning has started. We're in full support. I think the intent there is that the hospitals will continue to be the center of critical care, or the most sick patients, and then we would use that field hospital for lesser sick patients, if that makes sense. Lower acuity patients, Mike.
But for us, you can never plan too much in a crisis like this. So having that as an asset for the community, I definitely welcome it. And we just have to all agree how to utilize it as it can be its best.
Thank you.
Hi, this is Anna Torrea from Action News Now. Can you guys hear me?
We sure
Hello?
can.
Hi. Okay, cool. Yeah, just piggybacking off of the field hospital, because it was announced yesterday that it was going to be Redding Civic Auditorium. Have you alerted like the Sheraton that's nearby and neighboring people that field hospital is already in the works before it was officially selected? If that makes sense.
That is a very specific question, and I am not sure if they alerted the surrounding neighbors.
We're across the street, and no.
Okay, so I'm going to go with probably not.
Okay, and then just piggybacking off that a little bit more, like I know there were 3 locations that were considered. What made Redding Civic Auditorium the choice at the end of the day?
Was not made by us. I believe it was made by the federal government, but our hospital partners may have additional information about that. Or sounds like maybe not.
The Army Corps of Engineers made the decision.
This is Kenneth from Mercy. Can you hear me?
Yes, we can.
Okay. So we had a meeting last week, and we talked within Donnell, or it was actually earlier this week. We talked with Donnell, and we decided as a group between the county and the facility and the hospitals which location we thought was best. It was between 2 of the locations, and we felt that the Redding Civic Auditorium was the best selection because it is in close proximity to the hospitals.
Thank you for that excellent answer. Any other questions?
Yes,
Sorry.
can you hear me?
Yes, we can.
So
there.
I'm Renee. Oh, is this Donnie? Or I'll just wait then.
It's me. Okay, it's Donnie. Sorry, Sadie, we went at the same time. I have a question for Mark at Shasta Regional Medical Center. Can you tell us more about the negative pressure isolation ward for COVID-19 patients? And
Sorry, Donnie, I got that first part, but I assume just giving you a brief overall description of the unit that we have prepped just in case we ever needed it. Is that the whole question?
yes, basically, can you describe what that isolation ward is like and where it is located in the hospital? And I'm assuming it's just for COVID-19 cases. And I was wondering if Mercy Medical Center had done the same thing. Thank you.
Sure. So what we have right now is a 16-bed negative pressure unit that we can rapidly expand to 32 if needed. It's in an isolated area of the hospital, and the entire area is for like a med surge style of patient that would go there. And if we seem to get inundated with a significant amount of positive patients, then we can co-locate them into one area. So we are able to make a safer space for the patients and the staff and kind of co-locate a lot of the supplies. So we are much more efficient in our processes. Hope that answers that question.
Yes, and I guess the follow-up question.
Sorry, I caught none of that. Did anybody else?
I'm sorry, Mark. So my follow-up question.
Hi, Donnie, you're showing as muted right now. It just went to mute in the middle of your comment.
I think it's a bad cell phone connection, but I'll just reiterate kind of what Mark said. Our plan is tiered or staggered. So we have parts of our ICU that we've sort of set aside for patients, and then we have different areas throughout the hospital, depending upon how many patients we might get at any stage within what we're calling this surge, that we can generate the negative pressure environment. So we have many of those environments live today, even though we don't necessarily have COVID positive patients on them, just out of a state of preparedness.
All right, thank you. And Donnie, if you want to ask, since the audio is not working super well, if you want to use the chat function or email to Tim Mapes can text me the question if you would like. Are there other, yeah, go ahead.
Hi, I don't know if you guys can hear me.
We can indeed.
Hi, this is Shasta from KRCR. So I do have a question regarding how long a patient has to wait for their test results to come back if they've been tested for COVID-19.
So if they're tested in a public health lab, as Carrie explained, if they're in by 11 o'clock, we test them same day. If not, then they would get done within 24 hours. And if there was something urgent, of course, we would take that into consideration. As far as the commercial testing, it seems to be variable. I'm hoping that turnaround is going to improve, but it seems to be, I've heard from community providers, maybe a week or so, some a little longer, some not quite so long.
So there was a concern, a viewer reached out to me about they're a nurse in the Los Angeles area, and they were explaining about how they have rapid testing and that their mother, who currently is living in Redding, was tested for COVID-19, and she expressed her frustration because the mother was told that she would get her result in 14 days. So my question is that the normal amount of time someone should wait for results to come back for them?
Yeah, really none of this is normal, I would say. So testing capacity is a big problem. And I think that many resources are actually being directed to the urban areas that seem to be having more transmission than we do here in the North State. And so some of those point of care labs that have just come on within the last few days, actually, many of partners here and ourselves have been exploring those and trying to get on the list to actually get some of those resources. And it sounds like LA County was able to get theirs. So not available locally to my knowledge yet, but we are all scrambling and trying to follow up on any leads we can on testing opportunities. 14 days seems long. I think potentially when commercial testing first got going earlier in March, that's a possibility. It could have taken that long. But now my understanding is it's on average somewhere around a week or so. Hopefully that will shorten even more.
So is our area planning to receive rapid testing in the near future? If so, when? If that is
would be fantastic. That would be fantastic. As soon as somebody will give us, put us higher on a list and let us actually get one of the machines that are being high demand, nationwide. And, we're doing the best we can. But if the vendor doesn't have them available, or they're prioritizing, them to other areas, and those decisions are being made outside of our control, there's really, all we can do is try and look at a variety of different options. And so we have a lot of feelers out to different companies. There aren't a lot of possibilities to choose from right now, but we're looking into everything that we can come up with. So hopefully soon.
Shade, I'll just add that we've been frustrated as well. So we expected to get a large supply order for our testing platform, so that we could potentially be live by today. And unfortunately, that order was diverted to a large metropolitan area. So we're hopeful, we're crossing our fingers that we get a small order next week that'll at least allow us to partner better with the county on testing that needs to be performed immediately. And then I want to reiterate about our county. Our public health lab is working 7 days a week, and they are turning test results around, I think, as quickly as they possibly can, which, to Dr. Ramstrom's point, has been around 3 in the afternoon. So as long as we get tests to them, they're turned around promptly.
Great, thank you so much. Thank you.
I wanted to clarify also, I got an answer on the question about the neighboring businesses, and our CEO has shared that we are in the process of finalizing the lease, and we'll let neighboring businesses know as soon as that happens for the mobile unit.
That's sorry, Anna Torreya from Action News Now. That's for the field hospital, correct?
Yes, that is correct.
Okay. Actually, I do have a question. I also kind of want to just piggyback off of that. Since it is next to a very public area, just wanted to know, are there any concerns, because this field hospital is right next to like the Sheraton, as Mike had said, right next to KRCR, and our office is just down the street too, in Turtle Bay. Just wanted to know if there's any concerns that the public should be aware about.
None that I can think of. None that I can think of.
Cool. And then also, I do want to piggyback off a little of that and just following up, what precautions will be taken at least for this field hospital once it's, set up and everything? Because I believe it's going to start setting up next week, correct?
Can you clarify what you mean by precautions?
Yeah, just safety precautions, because I don't know, for me, I feel like I would see, since I work in this area, I would see a lot of people coming in and out, or like possible patients who will be getting tested. Like, will there be triage tents set up in the area or anything like that? Just what safety precautions for the Civic Auditorium, at least?
Okay, so so the facility is for non-acute care. And so in terms of, it looks like, so our CEO is helping me answer this question for you right now. The facility is for non-acute care, and there will probably be security involved in that. We'll probably have a little more information for you once this whole thing gets rolling. It's been a very, very fast-moving process and a very big and cumbersome process to get this going. So I think that's about the best we can do for you right now today in terms of that question.
Okay, thank you. And then just to clarify also too, sorry, just want to get it all done out here. How many beds will the field hospital be able to hold?
Shasta County will have 125 beds. And to clarify, I think that you know this, but just to make sure that we're totally clear, the hospital will not be open when it gets set up. It's just going to be set up so that it's ready when it's needed. We're not going to be putting patients in there right now. At this moment, our hospitals are not overwhelmed. And so, so right now it's being set up so we can be ready.
So it's just more like it's on standby in case we start to see an influx of cases.
Very well stated.
Okay.
Just to clarify, Carrie, for the reporter, the thought is that these would be non-COVID patients in that facility, right? I just wanted that to be clear.
Yes, thank you for that clarification. It is definitely for non-COVID patients. Any other questions this morning?
Sorry, Anna Terray here again. Sorry about that.
That's
So
okay.
really want to make sure we're on the same page. So the field hospital for Redding Civic Auditorium is going to be, like you said, for non-COVID patients. So it's more like for just acute patients, like who are experiencing flu-like symptoms, I'm assuming.
It's for non-acute patients, non-acute patients. Yes, and so the idea is if there were to come a time when our hospitals had a very large number of patients who needed medical care for COVID-19, we would take other patients who need less level of care and bring them to this facility.
Okay, thank you. Actually, I do have a few more questions I want to ask about this. It's not that many, but I really appreciate you guys answering all these questions for me. What about resources? I know we're seeing a lot of, masks and PPE supplies, low on all of that, but where will the medical staff be coming from to help serve this area at least?
Mr. Germano, could you help with that question?
Where are we going to find PPE I'm sorry, I didn't get all of it, for the field hospital or just in general?
Just more like where would the medical staff, like the doctors, the nurses, where would that be coming from? Like what parts of the state or the North State will they be coming from?
Well, I think that's one of the areas that where the community's health providers are spending a little time considering where they're going to find folks to actually staff the facility. The hospitals have to have their own staff they have to worry about to make sure they staff their needs, and they don't know yet what that demand's going to look like. There's also the risk of what happens if health providers get sick in the hospitals. You need folks to support that. So I think the outreach right now is going to be for people who may be retired, people who work in the outpatient setting, and a lot of doctors' offices are closed, so there may be workforce there. California has the California Health Workforce Group. and they're getting names. They had over 32,000 people sign up for that. Now, I don't know how many are from the North State. The governor did say that not everyone's going to get a job to support these field hospitals, and a lot will depend on geographics, your skill set, those kinds of things. So we have a lot of work ahead of us as a community to figure out how we're going to support that facility. And remember, if and when we do have people in there, it's going to be a 24/7 operation like any hospital. So those logistics are very real and are something we're going to have to figure out here.
Awesome. And then just one more question. How long can we expect this field hospital to be up?
Yeah, I can address that. So I think initially I think there's a lot of unknowns. We're going to use it for as long as we need to. And I think that initial, time frame is looking at about having it there for about 6 months. But if we don't need it so long, we'll shut it down sooner. If we need it longer, we could extend it.
Yeah, I have a question. I am confused anew with this revelation, at least revelation to me, that the field hospital would be non-COVID patients. Does that mean that the hospitals would be, if need be, dedicated to just COVID-19 patients, and the field hospital would be set up with radiology, maternity ward, all the things that you have at the regular hospitals now? How involved is this field hospital going to have to be, and what sorts of patients are you talking about would be sent there? Would it have a trauma center?
So great question, Steve. And the answer is no. So think of this field hospital as a very simple medical station, if you will. So the intent is we are not going to stop any of the services that we provide, right? Our level 2 trauma program continues. Our level 3 NICU program continues. Our maternity program continues. We have contingencies based on how many patients our community actually suffers from COVID. But when you think about what you've heard across the country and across the globe, the truly critical patients need to be in our ICUs. They need to be cared for by our intensivists. So other patients that come in, as their level of care drops to a lower level, if there's the ability for us to move those patients to this field hospital so that we can make room for sicker, higher acuity patients inside the hospital, that's how we're going to use it. We might also see a time when maybe we have patients that just need some monitoring, and maybe they don't have a place to go, or maybe there isn't a rehab hospital or a skilled nursing facility available to take them at that time. The field hospital then becomes a place where they can go and get that, what we'll call a lower level of care.
So currently you have these isolation units at SRMC, this 16-bed isolation unit, and I assume that you have something equivalent at Mercy. As the number of COVID patients increases, will these isolation units expand to larger areas of the hospital? Will they take up more space in your hospital?
Well, our strategy is just a little different. So we're taking the strategy that we will ramp up as the demand is there or as the need is there. So here at our facility, we have the ability to turn many of our units into negative pressure. So if we got to a point where we would need to actually leverage a whole unit of the hospital, we can do that. If we had a mother that was needing to give birth, that for some reason we suspected she might be COVID positive or she is COVID positive, we have the ability to take care of that within our general maternity ward today. You know, even within these units, we have the ability to segregate rooms or isolate certain areas within a pod to negative pressure. So key is, how do we isolate these 1 and 2 COVID positive patients that might actually be in different areas of the hospital because of their medical condition? So again, we're fortunate that our hospitals were built such that we can do that.
Just
So
to bring it down to my level, if you could, by negative pressure, you mean that no air escapes these certain areas except by however you want to ventilate it to.
Correct.
All right.
Okay, any other questions before we let you all go for the weekend? All right, thank you very much, everyone, for being here. We will be here live again on Monday morning, 11 a.m. We will see you then. Everybody have a safe and enjoyable weekend.
Hey, Carrie.